Dentistry in General Advocacy Coalition presents 2025 ADA's House of Delegates Special Edition. As dental education evolves and concerns mount about the variability in clinical preparedness, the profession can no longer rely solely on outdated, high-stakes, one-day licensure examinations. With nearly every state now embracing non-patient or mannequin-based clinical testing, the urgency for a modern, competency-based, and longitudinal model is clear. A nationally available postgraduate Year 1, PGY1, pathway, mirroring the proven success of medicine and pharmacy, offers a structured, evidence-based method to ensure true readiness for independent practice. More than just an alternative exam, PGY1 represents an opportunity to strengthen licensure portability, uphold professional standards, and protect the public by ensuring that every new dentist enters practice with comprehensive, real-world competency. Resolved that the American Dental Association, ADA, direct the Council on Dental Education and Licensure, CDL, to study the feasibility of a nationally available postgraduate Year 1 PY licensure pathway and to report back to the 2026 House of Delegates with findings and recommendations. Resolution 401. Dental students are graduating without performing the essential procedures that define a competent general dentist, things like crowns, root canals, and extractions. Dentistry is a surgical discipline, and surgical disciplines require repetitive hand-skilled training that is verified by a third party. Patients assume a dental degree means clinical readiness, but when schools lower standards or swap hands-on care for observation, that trust is broken. This isn't just an academic issue, it's a betrayal of public trust, and it's putting lives at risk. Schools are charging $400,000 in tuition while quietly cutting clinical requirements, blaming patient availability or competency-based models. Class sizes are exploding. Clinical experience is shrinking. Students are drowning in debt and being told they're competent without ever doing the work. Watching is not training. Guessing is not learning. This is how you create burnout before a career even begins. If CODA won't enforce real clinical standards, then we have to for our students, our patients, and the future of the profession. Vote yes on the original version. Resolved that the American Dental Association strongly encourages the Commission on Dental Accreditation, CODA, to establish and enforce a reasonable minimum national standard for patient-based clinical procedures required for graduation, emphasizing that competency must be demonstrated through direct performance, not observation. Resolved that CODA be encouraged to revise accreditation standards to ensure all graduates receive verifiable, patient-centered procedural experience essential for safe, independent practice, recognizing that as a surgical discipline, dentistry demands repetition of clinical procedures across all major disciplines, including but not limited to operative dentistry, restorative dentistry, endodontics, periodontics, oral surgery, and fixed and removable prosthodontics, in accordance with the ethical obligation to protect patients and the public. Resolved that the ADA strongly encourages CODA to consult with the American Dental Education Association, the Academy of General Dentistry, and appropriate specialty organizations in dentistry to establish clear minimum requirements for clinical competency, including specific patient-based procedural experiences necessary for safe, independent dental practice. Resolution 402. For too many aspiring dentists, the dream of entering the profession now comes with crushing debt, often exceeding $500,000, while many struggle with food insecurity, mental health crises, and inadequate clinical training during the very years meant to prepare them for safe, independent practice. Pre-dental students, raised in a world of reviews and comparative data, are forced to rely on prestige rankings, hearsay, or unverified forums because no outcome-based system exists to reveal where they can truly thrive. As schools expand while applicant pools plateau, the profession risks a dangerous race to the bottom in educational quality, leaving students to shoulder life-altering financial burdens without clear assurances of competency. Transparency is no longer optional. It is a moral imperative to protect both students and the patients who will one day rely on their care. Resolved that the American Dental Association, through appropriate councils and in collaboration with ADEA, AGD, specialty associations, and ASDA stakeholders, shall develop and publish the Dental School Educational Value Index, DEVI, as a public-facing, outcome-based transparency system. Resolved that DEVI shall include voluntarily reported and verifiable metrics such as average number of procedures completed across core disciplines, student-to-faculty ratios, general and specialty, total educational cost and sources of funding, access to wellness resources, food assistance programs, and mental health services. Reported levels of graduate confidence, satisfaction, and support. Resolution 406. Everyone agrees that dentistry needs a widely accepted license portability agreement between states, also known as a compact. But what the American Dental Association is currently supporting is not the right one. We need a compact that aligns with the standards our physician colleagues uphold, not one modeled after frameworks used in trades like cosmetology. The House of Delegates has directed the ADA to pursue a licensure portability compact, Transactions 2018-41, but it has never endorsed any specific compact. The ADA should be considering all proposed compacts and presenting them to the House for formal adoption and selection, not promoting one prematurely. Although a compact can support both private practice and corporate models of dentistry, the kind of fast movement promoted by the DDH Compact appears designed to serve entities that must deliver profits to shareholders quarter after quarter, not practitioners committed to continuity of care. The DDH Compact eliminates the issuance of full state licenses, shifts disciplinary power away from where care is delivered, and is being promoted alongside licensure pathways that exclude any hand skills assessment. That combination, license portability without accountability and testing without clinical validation, poses a direct threat to patient safety and public trust. The ADA's partnership with the Association of Dental Support Organizations in backing this compact risks damaging the integrity, reputation, and long-term self-governance of our profession. Resolved that the ADA shall not endorse, promote, testify in support of, or lobby for any specific compact unless and until such compact is formally adopted by the House of Delegates. Resolved that the ADA shall establish a transparent and neutral process to evaluate all licensure portability compacts, which shall include input from state dental boards, constituent societies, and appropriate ADA councils prior to any formal recommendation to the House of Delegates. Resolved that the ADA shall develop a compact framework modeled after the Interstate Medical Licensure Compact, which preserves state-issued licensure, maintains full disciplinary oversight, and upholds professional standards. Resolved that any compact supported by the ADA shall require a valid, uniform clinical competency assessment, including acceptance of mannequin-based clinical examinations, and shall reject any system that restricts participation to licensees of a single private testing agency.